Have you ever noticed that after a bump or a strain, certain movements just do not feel right anymore? When you experience an injury, it almost always impacts your range of motion, which is simply how far and in what directions you can move a joint or body part. This limitation is a fundamental way your body reacts to protect itself, often leading to pain, stiffness, and reduced flexibility. The primary reason an injury restricts your range of motion is due to a protective mechanism called muscle guarding. When tissues are damaged, the surrounding muscles involuntarily tighten and spasm to stabilize the area, preventing further harm. Think of it as your body putting a natural splint around the injured joint or limb. Additionally, swelling and inflammation, common responses to injury, take up space within the joint capsule or surrounding tissues, physically limiting movement. Scar tissue formation during healing can also become less elastic than original tissue, leading to long-term restrictions. To understand your specific situation, pay close attention to your body's signals. First, gently observe which movements are painful or limited. For instance, can you fully straighten your arm or rotate your neck as freely as before? Compare the injured side to your uninjured side to notice differences. A healthcare professional can then use specific assessments, like goniometry, to precisely measure the angles of your joint movements and track your progress during recovery. Recognizing the distinction between passive and active range of motion is an insider detail that helps you understand an injury's depth. Active range of motion is how for you can move a joint using your own muscles, while passive range of motion is how for someone else can move it for you. If your active range is limited but passive range is normal, it often points to a muscle or tendon issue, whereas limitations in both suggest a more significant joint or structural problem. This insight helps guide appropriate rehabilitation strategies. Ultimately, an injury's impact on your range of motion is your body's sophisticated alarm system, signaling that something needs attention. Understanding this protective response and how to carefully assess your movement is key to navigating your recovery and returning to optimal function, preventing re-injury, and supporting long-term athletic health.